Hi, my name is Tim Mackesey. I've been a speech pathologist since '92. I grew up with a stutter that I had to battle all the way through college, which explains the work that I'm doing here today. I want to tell you a little bit about young children who stutter. Did you know the greatest chance to stop a stutter is before age 7? The reason why is as a child approaches age 5, 6, and 7, they also begin to develop thoughts and feelings. They can compare themselves to others. They personalize teasing and questions about their stuttering. Some children begin to avoid. Some people begin to fear stuttering when they have to read out loud. So the time window is very important. One of the first things we want to examine is, does my child have a real stutter, or do they just have what's called developmental disfluency? On this website, you can watch a video called Stuttering and Your Child, Help for Parents. The video does a great job in the first half of showing you good samples of children who are stuttering so that you can look and see, does my child have a stutter or is he at risk for it? Also know that you have the best samples. You see your child when they're fatigued. You see them on a play date. You see them in the car when they compete to be heard. They negotiate with you sometimes. They interrupt. So you have the greatest sample size. Make sure you get some of it on film on your smartphone to show your doctor or someone like me so that you can make an informed decision whether it's time to act. If it runs in your family, that's a risk factor. Let's talk for a second about the styles of treatment. One style of treatment is an indirect and passive way to help your child, which is safe for everybody. That includes parents talking more slowly, parents putting pauses in their speech, and trying to reduce time pressure the best you can. Sometimes that passive and indirect way will get your child across that hurdle to smoother speech. A next approach involves things like turtle talk and snail talk, where a little child is taught sophisticated ways to stretch his words, control his breathing, never get excited. The chances of a 4-year-old child waking up in the morning, coming in the kitchen, and deciding inside of his brain, I'm going to prioritize talking slow all day, never interrupt, never rush, stretch my words like a turtle, the chances of that are nil. It's not going to happen. Then you move into a more direct approach. These are children that need to be helped when they're little. A more direct approach looks at the most chronic words and sounds that the child has and develops a pattern program to assist that child through the stuttering. Each year, children from about 15 different states travel to Atlanta, Georgia to get a unique and different approach. And there's a reason. Parents are in the appointments, are trained on how to help their children when they're not here. You're welcome to send us a video if you'd like for us to watch a video of your child. We will then either call you or you can call us and discuss your child. So thank you for checking out our site, and if we can help you, we're here for you.